Chennai.
As many as 69 million people suffer from type 2 diabetes in India, making it the diabetes capital of the world. Timely detection and the right management of the disease can indeed go a long way in helping patients lead normal lives. Hello and welcome to this special series, Live Well with Diabetes. This is our endeavor to spread awareness, bust myths and help diabetic patients lead healthy, normal and happy lives. Despite being one of the most common and most talked about diseases, the awareness around diabetes is still surprisingly very poor. So through this series, we'll meet renowned doctors from across the country and bring you expert advice on living well with diabetes. We are beginning the series from Mumbai with this first episode, and today our aim is to create awareness about pre-diabetes, understand what diabetes is all about, what are its symptoms and the complications that uncontrolled diabetes can cause. On the show today, we have Dr. Vijay Negalur, a senior diabetologist from Mumbai. He's a consultant at many reputed Mumbai hospitals, teaches diabetology and is also a founder member of the Association for Diabetes Care and Prevention. Also on today's show, we have Dr. Phul Renu Chauhan, a renowned endocrinologist from Mumbai. She's a senior consultant and also the head of the Department of Endocrinology at Mumbai's PD Hinduja Hospital. And lastly, we have Dr. Manoj Chadha, a leading endocrinologist from Mumbai with over 3 decades of experience. He also teaches endocrinology at leading hospitals and medical colleges. Welcome, doctors. Thank you for joining us on the show today. It's a pleasure to have you. So perhaps I'd like to open the discussion by asking you, Dr. Negalur, what exactly is diabetes? It's right that it's commonly talked about. All of us have heard the term, but can you break it down for our viewers? What exactly is diabetes and how many kinds of diabetes are there?
Yes, when you say a person is diabetic, he has a blood sugar which is fasting more than 126, and after lunch it's more than 200.
Right.
If you look at normal values, the fasting sugar should be 100 and the postprandial should be 140. If somebody has beyond 126 fasting and 200 post-lunch, he is called as diabetic patient.
Right.
And those people who have a range between 100 and to 126 fasting and 140 to 200 in the postprandial range, they are called pre-diabetics. So we have both diabetes and pre-diabetes, which is very common in this country. As you said, there are 70 million diabetics in this country. Yeah. And what is most alarming and worrying me is the equal number of pre-diabetics in this country, which is almost up to 70 million.
Right.
That means every 5th Indian is a diabetic, and every 5th diabetic in the world is Indian. So India forms the epicenter of the epidemic of diabetes with such a large alarming population of diabetics in this country.
Right. So that's quite an alarming situation. Dr. Chadha, if I can bring you in at this point, most people know that insulin has something to do with diabetes, but break that down for us. What exactly happens? How do the levels of insulin play out for a diabetic patient?
So we understand that insulin is one of the most important hormones for glucose metabolism. And put it in simple words, we are talking of a state where initially insulin is not working well. We call that insulin resistance.
Right.
And then the body initially compensates. At a time will come where the beta cells, the cells which produce insulin, they start failing. And then that leads to a state of insulin deficiency and diabetes. Right. So put it in simple words, initially there's an increased demand on the pancreas to make insulin, which is compensated. And then later on, the beta cells start failing, so the supply becomes less. And that's the stage what Dr. Negalur was just talking about. You're going from the pre-diabetic to the diabetic stage.
Right. And talking of pre-diabetics, Dr. Chauhan, what exactly is pre-diabetes and what are the precautions that a pre-diabetic patient can take in order to avoid becoming a diabetic, or at least, delaying the process of diabetes?
As Dr. Negalur has already
given you the range that just before diabetes is hit upon, any fasting blood sugar between 100 and 126, and post-meal or post-glucose blood sugar between 140 and 200. Or nowadays we do what is called as glycosylated or HbA1c, which gives you an average of previous 2 or 3 months blood sugar. If that is between 5.8 and 6.3, that is a pre-diabetic state. As Dr. Neglur has already suggested, that large number of young Indians, both males and females, whether rural or urban cities, are getting into the state because of wrong lifestyle, obesity, midriff becoming bigger than the rest of the body, and lack of physical exercise. So large number of patients unaware. People are not aware of this particular situation, are already heading towards diabetes, and it's escalating.
So, Dr. Neglur, what are the signs and symptoms of diabetes? How does one get to know if one is a pre-diabetic? Is there, apart from a blood test, are there any other symptoms, or is it primarily asymptomatic?
Yes, as you said, the large population is asymptomatic. Many of them are surprised to see their blood sugars are very high. They quite often ask you, is the lab wrong? Because I have no symptoms. So therefore, the large number of people have no symptoms, but there can be few symptoms, for example, fatigue, tiredness, exhaustion, loss in the weight despite of good appetite. They have a good appetite, but still they lose weight. The large number of patients have visual disturbances, and some of them have a sexual disturbances. So these are some of the few symptoms that you get. When you talk of signs, when a doctor examines a patient and he finds some of the defects, these are called signs. And classically what is called acanthosis nigricans, which is a dark patch around the neck or in the armpits, which is a classical sign of insulin resistance. That means these people do not respond to the adequate dose of insulin. Secondly, you have the hypertension, which is very common. 40% of patients of diabetes have hypertension. So that's very common. And secondly, as Dr. Chauhan mentioned, there's a large amount of central obesity. These people have very large tummy, which is more than 90 centimeters in men and 85 centimeters in women. So these are some of the important and relevant symptoms and signs in a given patient. As I mentioned to you earlier, large number of people do not have any symptom or a sign to suggest they are diabetic.
So one should keep getting blood sugar checked every couple of months? Yes,
very often, especially after you have 30 years in this country, people should get their sugar checked up, especially the parents are diabetic. Then more reason they should suspect, because being Indian itself is a risk factor to develop diabetes.
Right.
And just add to that, I think when you mentioned about parents being diabetic, we would recommend an annual checkup. Simple, we don't need any fancy health checkups. Blood sugar, fasting and postprandial is good enough.
Right. Okay, so on that note, let's take a short break right now, but stay with us because on the other side, we'll find out the different types of diabetes. You're watching our special series, Live Well with Diabetes. Welcome back to our special series, Live Well with Diabetes. This disease is known as the silent killer because this single disease can severely impact many vital organs of the body if left uncontrolled. So what are the different types of diabetes? Are they classified according to insulin levels? Could you take us through that?
So technically our books would say that there is a type 1, which is normally in common language a diabetes of the children, which I'll tell you is wrong. And then there's a type 2 diabetes, which is supposed to be diabetes of the adults, which again, now things are changing. So this would sort of account for about 95–96% of the diabetes. So we are seeing type 1 now in adults and type 2 in children.
But how are the type 1 and type 2 classified? Is it on insulin levels?
No, so type 1 classically is a state where the beta cells have been damaged because of an autoimmune reaction. Whereas type 2, what we've been talking, is insulin resistance, a defect in the action of insulin with an increased demand on the beta cells. So they initially do well with tablets and diet control and exercise, but 20–25 years down the line, they may need insulin. In addition, then we have a well-defined group of diabetes which comes up in pregnancy. So that's called gestational diabetes. Very important now because we realize a lot of problems of childhood and adulthood start in the mother's womb. So gestational diabetes has to be taken equally seriously. And then there is a large heterogeneous group, what we call a secondary diabetes, because of genetic defects, endocrine defects, drugs, liver disorder, kidney. So it's a heterogeneous group, and it just helps us giving the etiology. The management remains the same.
I see. And Dr. Chauhan, what are the common myths around diabetes today that you come across? Every disease seems to have some sort of myths that people believe in. When it comes to diabetes, what are those myths, and can you bust some of those for us?
Some of the commonest myths which we face is that, we thought the diabetes comes only later on. We think diabetes comes only when you are obese or you are fat.
Yeah.
Or we never had any symptoms of diabetes. We thought it's associated with excessive urination, thirst, weight loss, sexual dysfunction.
Yeah.
Then, we have patients who say that हमने कभी मीठा चीज़ खाया ही नहीं है. We don't eat rice, we don't eat potatoes, we don't eat sweets. How can we have diabetes? Or the other side of the myth is that can we have sugar? Can we have fruits? We were told we cannot have it all. And the worst kind of myth is that our sugars have been around 200 all along and we've never felt a thing. So why should we do anything particularly so?
Right. So physically, if you're not feeling anything, then you think you're all right and you don't.
Yeah.
So Dr. Negalur, I wanted to ask you, what are the sort of complications that really arise if you leave diabetes unchecked? Because, if people believe that the sugar is at 200, but I'm not feeling a symptom physically and I leave it unchecked, what can really go wrong? And what sort of implications does it have on the vital organs of our body?
It's a very valid question, because many times the patients say this, that I have a good sugar all right, but I have no complaints. Why should I take treatment? The need to take treatment is to prevent the complication. Nobody dies because of diabetes. They die because of complications. Now, what are these complications? They can be divided broadly into two groups. One is a small vessel disease, we call it a microvascular disease, and the large vessel, which is called macrovascular disease. The small vessel diseases especially start from retina. The blindness that you get in diabetes is about 25 times common compared to non-diabetic patients. Then you get what is called kidney involvement, which is called nephropathy,
right,
which is 18 times common compared to non-diabetic. If you look at the dialysis unit, 50% of your patients are diabetic who undergo dialysis. The peripheral neuropathy, pins and needles, difficulty in walking, the ulcers on the feet are again common in these diabetic patients. We get 40,000 amputations per year, which is called a non-traumatic amputations, which is because of diabetes. Such a big impact, it's on the microvascular. Coming to the major vessels, you get strokes 3 times common in diabetics compared to non-diabetics. Myocardial infarction or heart attacks, again 3 times commoner than in a non-diabetic population. Besides this, we also have complications like infections.
Right.
Tuberculosis is very common with diabetes. Then we have infection like otitis externa, which is a very bad disease which can be seen in diabetic patients.
Yeah.
The gallbladder infections, the urinary tract infections, and of course the other various kinds of infections you see very commonly in diabetic patients.
So it really makes you prone to every other disease that there is.
Yes, you just name it, it is there in diabetes. So it's such an impact.
What about bones, Dr. Chadha? Does it also have an impact on our bones?
You just said diabetes affects every organ system from the head to the toe. And interestingly and surprisingly, you asked about bone, because this is something, it's one of the hot topics today in diabetes. Because up to about a decade ago, we never looked at bone as a problem in diabetes. But we realize now that the problem of diabetes, whether it's type 1 or type 2, and the duration of diabetes can affect the quality of the bone. So when we talk of osteoporosis or osteomalacia, that's generally described because of vitamin D or calcium problems. But diabetes per se changes the quality of the bone and thus increases the risk of fracture in these patients.
Yeah.
So that's one major problem. And now we also understand that the medications that we use for diabetes, so some of them can affect the quality of the bone and thus lead to increase in fracture risk.
All right. So, Dr. Chauhan, another term that we hear very commonly is hypoglycemia, especially when it comes to diabetes. What really is hypoglycemia, and how can a diabetic prevent himself or herself or treat hypoglycemia?
Hypoglycemia means there's a fall in the blood sugar or low blood sugars, to be very exact. And a diabetic patient has a particular threshold. If you look at subjective hypoglycemia, patients will start feeling tremulous, palpitations, sweating, dizziness, excessive hunger, irritable, anger. These are all symptoms which we say these are warning signs for a patient, wherein the patient knows that now the sugar is falling and he should do something about it. Right. Mind you, each patient has his own symptom that he can recognize. And while we are educating patients about hyperglycemia and complications, we also teach them about how to recognize low blood sugars. Now, if you look at definitions of hypoglycemia, anything less than 70 or 80 is termed as hypoglycemia, provided there are symptoms. Right. But sometimes with the age of diabetes, symptoms disappear and directly the patient becomes drowsy or even goes into convulsions, especially children, or they become comatose. Therein the sugars are really low, 40 or 50. Right. But before they reach this particular level, we teach them as to how to recognize and treat. Elderly patients, we are very particular. We ask them to carry glucose powder, or nowadays there are glucovita tablets available, and which are very easy to take. You can take 2 tablets with water. Right. And it doesn't end over there, because hypoglycemia continues. You might get some relief with glucose or glucose tablets. We tell them to take a snack or to carry a snack wherever they are traveling or going out. In my clinic, what I tell all the patients that you must have something, some sweets in your bag and a biscuit packet such as Marie biscuit and a bottle of water. It's very difficult to eat something like bread or roti or biscuits without water. Very important. When they have serious hypoglycemia, wherein they are drowsy or comatose, they have to be taken to the hospital and intravenous glucose has to be given. Sometimes in children, they are not able to tell you that the sugars are going down. So we have these injection glucagon, which we ask the patient's parents to keep. And they just have to jab the injection in the child. This is not very easily available in our country, but it is available. It's very good for the kids. Right. For children, this is required. For adults, they themselves recognize the signs and they treat it. Of course, monitoring is the best way of preventing hypoglycemia, just as hyperglycemia. Right. And if you monitor your blood sugars, you can adjust your dose, your meal timings, your exercise schedule, your office timings, so that everything coincides and the sugars don't go down. So monitoring, again, is number one. And then recognizing...
And being very disciplined about your meals and, the timing of the meal is important.
And often we forget to eat. Or children, when they are playing, they often forget to take an extra snack. So if we educate them, these hypoglycemic episodes can be prevented. And sometimes hypoglycemia can cause real serious consequences besides becoming comatose. It can create a heart attack. It can create a paralytic attack in an elderly individual. So again, very important to teach the patient.
All right, time to take another quick break right now, but stay with us because in our final segment, our expert doctors will share tips on managing diabetes with a healthy lifestyle. You're watching Live Well with Diabetes. Welcome back to Season 2 of Live Well with Diabetes, our special series that shares insights on managing diabetes and leading a healthy lifestyle. So in this final segment, doctors, I'm going to ask you all to give us tips, give our viewers tips on how to really manage diabetes, how to live with the disease and remain happy and lead normal lives.
Once you become diabetic, don't get scared. Don't listen to the people who are unscientific, because many times I see people going to unscientific people who promise them false things and they come in deep trouble. So not to listen to them, but the simple instruction I tell them is diabetes can be easily controlled. You can have a good near normal life if you take good care of diabetes. And the principle is 4 pillars. This is what I tell the patient. The 4 pillars are 2D and 2E. What do these stands for? 2D stands for drugs and diet, and 2E stands for education and exercise. These are 4 important pillars on which the entire treatment rests on.
Dr. Chauhan?
Again, lifestyle modification, and stay with it as much as possible. We generally tell the patients that you can do whatever you are doing, but within limits. It's impossible to follow diet or an exercise protocol for the whole of your life. but it has to be reasonable limits. And the most important thing is monitoring. Monitoring blood sugars, look out for complications. Most of our patients feel that when we are 60 years old, we'll get a heart attack or we'll be paralyzed. But that is not so. We have patients coming at 20 and 25 in our casualty with a heart attack. So I think education, as Dr. Neglur has said, is very, very important, and we need to re-emphasize.
Dr. Chadda?
So, yeah, it'll sound I'm repeating what these two have said, but yeah, I think monitoring is very important, and I normally tell my patients, irrespective of whom you go to and what the doctor talks to you, it's your responsibility to get your eyes checked up once a year, your teeth checked up once a year, your HbA1c minimum once a year, lipid profile, and a urine test for your kidney function. These are the minimum 5 things that have to be done. So I think they have to accept the fact that there are no shortcuts, there are no magic cures, and if you want to do something, it has to be time tested, it should be under observation, and then wait for miracles. Till such time, I think what Dr. Chauhan and Dr. Neglur have said is, it's the patient who has to take care of his diabetes.
All right. So take charge of your life, and really prevention is better than cure always. Thank you so much, doctors. It's been a pleasure talking to you. And with that, it's a wrap on this first episode of Season 2 of Live Well with Diabetes. Hope these valuable insights from our expert doctors will help you manage diabetes better and lead happy, healthy and normal lives. We'll continue to bring you more advice from some of India's most renowned doctors through this special series. Thanks for joining us today. Until next time, it's goodbye.
Focus, ideate, innovate, enable.